It's Thursday, the 7th of November, 2024. Good morning and welcome. It's 8 a.m. in the Gambia and live on West Coast Radio, it's Coffee Time with me, Peter Gomez. And Coffee Time is brought to you in association with partners led by TAF Africa Global, Easy Financial Services, Bloombank Africa, Global Properties, the Gambia Experience, the USA PEEC and GAM Food Trading, and Wave.
The American Chicken Festival 2024 is here. Join us for the second annual celebration of all things chicken on Saturday, November 23rd at Hyperlink Village, Palmer Junction, Bethel Harding Highway from 12 p.m. to 12 a.m.
Hello, I am Chef Bode. I'm excited to return for the second annual Chicken Festival.
With over 40 international options from a diverse list of vendors. Music by DJ Wanjo, raffles, the variety show, and plenty of family-friendly fun.
From local to international, we got something for everyone.
Come see and taste the difference. Make it a date and don't be late.
Also on the program, we have today's newspaper front pages. And our guest this morning is the Chief Executive Officer of Bundung Maternal and Child Health Hospital. What's behind the success of the facility and what further improvement plans does the management have? Thanks for joining us this morning.
Hello. If I own a business account with Trust Bank, how can I pay salaries to my employees to other banks?
Kindly send us an instruction through your corporate officer, that's your relationship manager. Send the instruction through a hard copy and we will kindly process for you. It is easy, it is simple. We will need few information from you. Each customer's name, the BBAN and the bank it needs to be sent to. The BBAN should be complete and it should be in 18 digits. Please kindly forward this and then it will be processed the same day and all the funds will be credited in other banks as well. Thank you.
Good day, my people. My name is Marcel Sanyang, Bank Farafenya branch. I just want to encourage my customers to use our mobile app and use our ATM. You don't even need to come to the bank to do any transaction. You can be at your home and you do your transactions. You can also use our ATMs. When the queue is long, you don't even need to enter the bank. Just use the ATM and off you go. I just want to encourage all of you that Trust Bank, we are here for you. We will make sure that we give you all what you need in your banking. Thank you.
We begin our newspaper review with Foraya. Severe water shortage grips residents of Bundung for months. No plans to de-gazette Salaji Forest, says Environment Minister amid controversy over temporary permit. IMF and the Gambia reach agreement on economic policies. Regional Soil Fertility Mapping Project launched. Over 600 applications received for work in Saudi Arabia. Procurement officials accuse KMC of flouting rules, and NRA and Infrastructure Ministry inspect OIC urban roads projects. Next, we have the Voices front page. Gambian manufacturers raise eyebrows over Senegal's illegal levy. COPG to take to the streets today over 2020 draft constitution. Dr. Cisse tells Mamady to go political and stop hiding behind activism. And Mamady says Dr. Cisse targets voices of transparency and accountability. And LGCI chair threatens KMC's administrative director with jail time for defiance. Here's the front page of The Point. FPAC tells ministries to renovate government complexes and stop renting. IMF and the Gambia reach staff-level agreement on second review of extended credit facility. Lead counsel grills KMC's Kanyi. Apollo lands in destination Gambia with over 100 Nordic tourists. EU resolves to promote press freedom in Gambia. State withdraws evidence of drug substance in Paulo Jabi's case. And the 7 things Trump says he will do as president. And finally, the Standard. Police permit protest for return of 2020 draft today. Gambia expects $11 million more IMF support. Health officials' trial continues with investigator revealing about $11 million payment to Hebdo. Tostan Gambia gets new advocacy ambassador, and Trump seals historic comeback victory. And that's today's newspaper review. Our thanks to Foraya, The Standard, The Point, and The Voice.
Looking for an establishment where value for money and unrivaled services with admirable turnaround time is guaranteed? The Port of Banjul is the perfect place for you, a vital gateway for trade offering connections to numerous global destinations. With improved infrastructure combined with a flexible tariff, the Port of Banjul remains a vital node in maritime trade. Along with its dedicated workforce, efficient service delivery, technology-inspired innovation, and an impressive record in handling all types of cargo, the Port of Banjul is also widely acknowledged as one of the safest ports on the continent, with no history of piracy. As a major player in the region's maritime trade, accounting for 90% of all imports and exports, we are more than just a transit point, but a vital cog in the global trade sphere. Come experience a hassle-free fast customs clearance inspired by our simplified trade documentation procedures, safe and efficient cargo and vessel handling. The Port of Banjul offers prompt, reliable and value-for-money service, and customer satisfaction is guaranteed.
It's Thursday, the 7th of November, 2024. I am Peter Gomez, and live on West Coast Radio, it's Coffee Time.
The American Chicken Festival 2024 is here. Join us for the second annual celebration of all things chicken on Saturday, November 23rd at Hyperlink Village, Palmer Junction, Bethel Hardin Highway from 12 p.m. to 12 a.m.
Hello, I am Chef Boja. I'm excited to return for the second annual Chicken Festival.
With over 40 international options from a diverse list of vendors. Music by DJ Wanjo, raffles, the variety show, and plenty of family-friendly fun.
From local to international, we got something for everyone.
Come see and taste the difference. Make it a date and don't be late.
Welcome back. It's Coffee Time, live on West Coast Radio. You'll find us at www.wcr.gm. Online, on air, we are on 92.1 FM. We're also now broadcasting on YouTube and Facebook. Now, given the importance of maternal health for our families, communities, and nation, how do we address maternal mortality and severe maternal morbidity? Well, some experts suggest it calls for a comprehensive approach that addresses health from well before to well after pregnancy. Well, one man whose health facility has become synonymous with safe deliveries is Dr. Mamady Cham, Chief Executive Officer of the Bundung Maternal and Child Health Hospital. He's our guest this morning, and he's come over to share the good news of BMCH. I believe that's the abbreviation.
Yes.
Welcome, Dr. Mamady.
Thank you,
Cham.
Peter, and to your listeners for coming to West Coast Radio for the first time.
Fantastic. Yeah. What's the good news about, Bundung Maternal and Child Health Hospital? Every pregnant woman in this country that knows about the health facility wants to go there for their delivery.
Thank you very much. I think the best people to answer that question might be the women who choose to go to Bundung. But
well, it's about what you're doing.
yeah, so we think we are doing better in terms of service delivery. Our delivery rate is very high, over 5,600 deliveries every year. And the good news is that over 98% of our births are live births. This is one of the things that may have attracted women, because women are the best in terms of communicating health information. Where health facilities provide better care, they communicate to each other. And that is why our clientele doesn't only stop in Bundung. It might interest you to note that only Of that over 5,000 deliveries we have, our catchment area, which is Bundung and its immediate surrounding, constitute only 17%. So over 80% of our birds are coming out of our catchment area. So one could justifiably say that because the pull factor is the quality of care provided.
Okay, the stats are impressive, but then there's something that is being done, at the hospital by the staff, that is responsible for this, great service. What's your secret?
Okay, now to start with antenatal care registration. Antenatal care registration is done and at the hospital, unlike many other facilities, all the mandatory tests screening are done for the pregnant women so that we have a baseline information of the woman. This include physical examination, laboratory screening, and you name them. These are done. So it's not that you do one, leave the other. We do it. And that the visits also, women comply. And additionally, the hospital introduced a system some years back where the male partner of the pregnant woman is encouraged to be coming with the wife so that whatever problem is discovered, they become aware of it and work towards addressing it. Rather than the woman come alone and here you tell her to inform the husband. If she's somebody who don't understand, the husband may think is the woman who manufactured that issue. So, and when men come to the clinic, their level of understanding on pregnancy and childbirth issues is higher, and they tend to participate in the care of their woman. The third component is the delivery. During delivery, okay, we have suites where every woman, partner and mother, is in one cubicle. You don't share the cubicle with another. And there you are encouraged, if you are comfortable, to allow your husband to be with you in the delivery room throughout labor and delivery.
So you encourage men to accompany their wives or partners, for the delivery.
Yes.
Yet it depends on the wife whether they, want the husband to be inside the labor ward or not.
Yes. Sometimes why we leave the wife to do, because it's personal choice. The wife has the right to allow somebody to come.
Okay.
It's possible the partner, the wife doesn't want him to come. So we cannot just make it a blanket rule. The right for the patient must be respected.
Okay.
So that's a principle being practiced.
Okay.
And the other thing is our theater. In case a woman is in labor and has a complication needing cesarean delivery, the theater is 24/7 operational. And unlike other facilities, we have always piled stock of transfusion blood in our laboratory in case of emergency. This is harvested from pregnant women they deposit during antenatal care. So you don't wait until you have an emergency. You are asked to go and mobilize blood. Blood is there. If you had not deposited during an antenatal, you will be given, but before discharge, your people will come and pay in terms of whatever quantity of blood was transfused to you. So these are assurances that women, I think, see, and also the bad outcomes and the care. On top of it, I think I need to mention this, Peter, for people to see. You see, even with the workload in Bundung, I think discipline amongst the staff is paramount. The management is not leaving it like that. There is close monitoring of performance, and also there is even a complaints box, and my office is open to any aggrieved patient can walk into my office and say, I have A, B, and C issue, and it will be investigated. So these are some of the things, and not only us, we have departmentalized we have principal nursing officers and all the places who are assigned areas for their close monitoring and any issue that come up from there, they are the one who investigate and report to management for redress.
So I assume that, the number of patients that you see on a daily basis is growing. I mean, how are you dealing with the challenge on space?
Space is our biggest problem. Let me tell you, we have 27, on average, 20 to 27 deliveries per day.
Wow.
And we have 6 delivery beds.
Only 6?
6 delivery beds. It's not uncommon for women to be waiting. And even those women waiting, you tell them, can you go to another health center? They refuse. They said, I've seen those facilities and I've seen Bundung, I'm staying. And after delivery, by policy, a woman should stay in the hospital for at least 6 hours post-delivery for observations. Now, that ward has only 14 beds. And that ward is admitting both antenatal, pregnant women, and post-delivery. So if 27 or 20 deliver, how can they fit there? And you have pregnant women who have complications. So
how do you fit them?
Yes, it's not uncommon for 3 women or more to be on one bed. It's not our wish. We are trying to see how best, but it's beyond us.
And do the women complain when you put 2, 3?
They don't, because we ask them at delivery that the place is full. I need to go to Fajikunda, which is nearer, or we refer it to Banjul. They will refuse. So
ideally, what should happen to take care of this problem?
I think expansion.
Is there room for expansion?
Yes, on top of the story building, there's room for expansion where you can build other floor. We will separate the antenatal and postnatal ward, and there will be more space. Yes.
Okay. And how much work is taking place already in that direction of, expanding the facility?
We have done an assessment using GumWorks, and they have submitted their submissions, which the board is working on to see how best the ministry can take it up to mobilize resources.
So it's for the ministry to ensure that
it's a public hospital.
The necessary expansion takes place.
It's a public hospital.
But you generate income. Can't you use that income to start the process?
The revenue we generate. Remember, we are a maternal and child health hospital, and most of the charges for pregnant women is waived. Policy-wise, they should not pay.
Very good.
Yeah, so...
Maybe that's one of the attractions.
No, that's also across all public hospitals. Okay. But they choose to. And it might interest you to note that one thing I observe, all these boys, most of these Gambian men who are in Europe and they come to the country and their wife get pregnant, they always press them to come to Bundung for their antenatal and delivery. Most of them. And some women come all the way from Basset to come and deliver in Bundung. But after delivery...
It's an opportunity.
Yes.
It's an opportunity to fundraise for the hospital.
Yes.
I mean, if these people who send their wives or sisters or nieces, over to Bundung, I mean, you could say, well, why don't you support us?
I think they are beginning to see that if the expansion is not done, it may have a ripple effect negatively, because it may compromise quality.
Yeah. Yep. Because for now, you are putting up to 3 women in a bed. Yeah. We could end up with, 6, 7, 8, 9, even 10 women, in a bed.
Unless the workload is too heavy for the staff at the moment. Especially now we are in the peak. Last month we have September we have 635 deliveries.
Wow.
Yeah.
635 new citizens.
Yes. And some of them have multiple births.
Who may not have been captured in the latest census.
No, they have not been captured. Addison.
So our population is bigger than
it
says officially.
As expected, yes.
Okay. Just before you came on, we were talking about, digitalization, for our National Assembly members, the use of digital tools to do their job, to help them become more efficient in their work. I suppose Bundung Maternal, Child and Health Hospital, has also embraced new technology, to better its service delivery. Can you, tell us one thing or two about that?
The hospital have, through the Office of the Director Health Service and in collaboration with SIFO, a Swedish-based institution, piloted a digital medical record system for patients. And it's called smart paper technology. It's digital in the sense that you use a form and input the data on that form, and the system reads it. And you have a number, a unique number. And once that number is read and put in the system, anytime you come and remember a number, you don't need to register again. But all your comings, if you have come there 20 times, the system will put all your visits in one folder. So even the clinician at his table, who has the app, can log in to see your medical history. And it also helps us in generating our statistics. That is why always at the end of the month, we have our statistics. As I speak, okay, we are in November,
yes,
but I have the September statistics.
And what do they say?
Yeah, let's say for September statistics in terms of let us say laboratory investigations.
Yeah.
For pregnant women, we've tested 2,204 women for hemoglobin level in the month of September. And in the same month, for children under 5 years, we tested their hemoglobin on 2,399 cases. And again, for children above 5 years, people above 5 years, the hemoglobin test was 8,637.
Wow.
So the systems help us to get real-time information. This helps us in planning. Assume you were in our recent performance review, you see our data is always available. We can always look into to inform our next action, and we use the data to make decisions.
Now,
but the smart technology is a way forward, and it helps patients rather than carrying multiple papers. When these things are there, when you have your number and you can remember when you visited, you don't need to. You can use it in your mobile app, and not only the number. If your next of kin whom you inputted, you remember the telephone number. Even if you forget the number they gave you, if you give that name of that person and his telephone number, when you input it in the system, he will show your name. Fantastic. But the challenge is, people think that takes time, so they will tell you, I've never come here before, even they have a number before.
Oh.
Yeah, so this is some challenges we are facing. They need to be oriented, but you talk multiple times, they think that if they tell you I have a number, I forget at home, you'll tell them, go and bring it. But just remind himself his telephone number, because always your number is linked to your telephone number. So if you forget your number, just give us your name and your telephone number that I came here. When they put your telephone number, your name comes.
Well, maybe start by asking them for their telephone number.
Yeah, I think that's the way forward. Now, even yesterday we discussed that rather than just going and re-registering them, just as a proxy number which was inputted.
Yeah. The person comes, say, well, what's your telephone number?
Yes, you input and get it.
Yeah, exactly. Yes. And then say, well, okay, what's your number for this place? So if they forget and tell you, well, no, I didn't have a number, input the telephone number, and then, their details will come up. And then you say, is your name Peter Gomez? They go, yes. Oh, so you've been here before. Can you remember being here before? And then, they will recall. Now, with the hospital doing so well, I mean, how is the ministry helping to ensure that it can cope, with the growth? Because if you started with 5 and 5 were happy, and 5 went and told others, you suddenly saw that your figures jumped to 10. 10 went to 15, 15 to 20. So it would mean that the more the patients you have to care for on a daily basis, the more resources, especially financial, you would require. Has the ministry or the government responded likewise?
Well, I think before I go into it, let me just give you a small statistics on the increase, which you have alluded to. Like the OPD attendance increased from 55,731 in 2022 to 60,404. You go to the accident emergency unit, increased from 2,372 in 2021 and rose to 7,280.
That is bad.
Yes, and 2022.
That is
and
bad.
Again, increased to 9,072 in 2023. Admissions increased from 2,201 in 2020 to 2,655 in 2021. Now in 2022, it went to 3,442. And 2023, it went to 4,176. Now, all this is telling us the increase in patient load. You know, the ministry, you cannot much blame the ministry for certain things because the ministry don't allocate resources. I think people need to understand that the ministry always send their request to the National Assembly for appropriation, but what the ministry sends is not all what is approved, and that gives the ministry a big problem.
Usually with health, the National Assembly is very generous. It's probably when they make their submission to the Ministry of Finance. Maybe that's where they are restricted.
Wherever, but actually, I'm not taking brief for the ministry, but I know that if they have the resources that the hospitals need, they would have. The minister is very concerned about Bundung, and he has prioritized Bundung, saying that he's seen the patient load. But I think also sometimes the National Assemblies need to see. You see, the patient load in Bundung is not hidden.
You have a National Assembly member
who is very active, though.
Exactly.
Very.
So
he's very proactive.
He should take your case to the National Assembly.
He has talked to many people about Bundung, about the need for expansion, and I definitely admire his tenacity in pushing our agenda, not only on expansion. Even if we have electrical problems there, this man will, even if he's at the chambers, will have to stop what he's doing to call Nawek to go to Bundung and solve the problem. But the issue of expansion is urgent. This is urgent because you cannot stop patients. We don't have a military health system. People go to where they feel their services, their issues can be addressed. And people can cross anywhere, either public or private. And for now, Bundung seems to be one of the facilities there are a lot of people up for. As I was coming, the outpatient was full. You go to the antenatal, it's full. Some people, women come there around 5 just to be able to get the antenatal card. We have to increase the number of days so that now that is, because it's risky for a pregnant woman to leave that early home, coming, could be attacked. So that's why now we have stabilized that. But for inpatient, we have, even sometimes the general wards are full, we have a private unit where I hope you will visit it, where it's 50 times cheaper than the private. This one is very cheap.
Do you find that, do you find your name to be a problem? That when people hear Bundung Maternal and Child Health Hospital, they feel that, well, okay, they only, cater for children and pregnant women, whereby, they could have come for other issues, other kinds of treatments. I mean, I know you spoke about the accident and emergency unit that can't be exclusively for pregnant women, lactating mothers. What other services do you offer by way of health service?
For the name, even though the name is Bundung Maternal officially, but 95% of Gambians
call it Jame.
If we call it Jame family, that you're going to take it from them.
Exactly. Yes.
So we don't. But for the services we are providing, the name implies we are more.
When somebody has malaria, for instance,
yeah, we have an outpatient. We have a general outpatient service department. This accident in emergency was also an afterthought. It was brought in. We have an infant welfare clinic where we give all this. We also have a gender-based violence clinic. We are more concentrated in maternal, neonatal, reproductive and adolescent health. But we also provide other services because we are within a locality. Even eye health service was introduced this year.
Eye care service?
Yes, eye
okay.
care service. Because we used to refer our patients to Zaid for basic eye care screening. Now it is being done at Bundung. The OPD is outpatient department.
But you don't have dental services yet?
The dental was suspended a bit because the one who was there went for studies. We are trying to get another replacement so that dental services will continue.
Okay.
But yes, as the name implies, we are more of maternal child health, but we also provide other services.
Yes, you provide general health
Yes,
services,
general health services.
As well. How do you keep your staff motivated so that they keep, providing this fantastic service that the hospital is known for?
Well, I think this month we are going to, last year we introduced a system of staff award where performing staff of 2022 were rewarded by a committee which have a lot of variables to look at, including performance, attitude, and other things. Mm-hmm. And for each category, the winner last year went home with a bag of rice, bag of onions, and 20 liter of oil. Yes, this year we are sending to sponsors who may wish to sponsor the categories, and the selection team have already completed their work. Hopefully, before the end of this month, we will stage it to identify the winners in a big gathering. And that's not only that, but to give them certificate of recognition. These are one of the ways.
I don't mind helping you fundraise.
Yes.
On average, how much are you looking for from, each sponsor?
Well, we are not paying any amount, because a given host not be look into the amount.
Yeah, but if you were given the opportunity to say, well, the least I expect is so much, where would you peg that?
$5,000.
$5,000.
Yes, $5,000.
Well, I hope people in the diaspora.
Yes.
$5,000 is less than $100.
Yeah, $5,000, where you can buy a bag of rice and something to give it to the staff, or you give them the money. Yep.
We're being listened to around the world. If somebody, outside the Gambia now wants to get in touch with the hospital for the purpose of sponsoring, one prize or more, what number should they call? Can you give a number that they can call?
Well, they can call my number, 799-7248, or the number of the chairperson of the committee, which is, let me say, the PRO of the hospital, Jim, is 791-7111. 791-7111. Or the chairperson of the selection committee could be Fantaseka, who is 298-0832. Okay. 298-0832.
All right. Dr. Cham, we've run out of time. What message might you have for, listeners to our conversation about Bundung Maternal and Child Health Hospital, or Jamia Foundation Hospital?
Well, I have to reiterate that our commitment to providing quality maternal and child health service still is as strong today than ever before. No matter what, we will stick to the principles of providing quality which the Gambian people need in order to. We should know that reproduction and childbirth is an essential undertaking of women's health, and it's a way through which the human race is propagated. Without providing quality care, we might give birth to people with disabilities, and that has implications for the overall development of a country. This hospital is committed to providing quality to women, and all the staff. That is a principle, and that motivates them. That's why they have a slogan: we don't stop when we are tired, we stop when we are done.
Fantastic. It's a good slogan. Dr. Mamady Cham, thank you very much for your time this morning. And Dr. Cham is the Chief Executive Officer of the Bundung Maternal and Child Health Hospital, also known as Jamia Foundation Hospital. You've been listening to Coffee Time with Peter Gomez. My guest tomorrow is Dr. Ibrahim Afal, and we'll be talking about the project masterclass that is coming up next week. Thank you very much for the pleasure of your company this morning.